Okay, hey guys, I'm on a couple of platforms today because we're going to be talking about how to start a home health agency in the state of Florida. Hey, how are you doing, Vlad? I haven't been on live on Instagram in a while, but I'm coming back. I am coming back. So I want to talk about there's been a lot of interest in starting a home health agency in Florida. And pretty much everyone says it is so complicated. They want to have a better understanding of how to complete the application. So we're going to go through it together. And this is for the home health agency. And let's just talk about why Florida has so many different license types. So I'm looking at the website. I'm on the AHCA, which is AHCA website. And if you go on their website, they have multiple provider types. So let's look at that real quick. Multiple provider types, very easy to get confused with that because of the multiple provider types. Let me make sure my screen is showing you what it looks like. Uh-oh. I got multiple screens. All right, I want to even share it I want to share it on YouTube as well. So sorry. Okay, so now that we're looking at it together, um, and you will have these resources, but um, these are multiple providers in alphabetical order. They can do adult daycare, adult family care, home, ambulatory surgical center, assisted living facility, birth center, clinical lab, crisis stabilization unit, drug free workplace, forensic toxology lab, healthcare clinic, healthcare clinic exemption from license, healthcare service pool. This is kind of like oh, can you guys see it? This is kind of like a staffing agency. Home health agency. We're coming back to this. We got the home health agency exemption. And then we have the home medical equipment provider. Let me make sure my screen is clean for you guys to see that better. Okay. Just showing you, we talked about the homemaker companion service provider. You can find that application, you can find that walkthrough on my Savvy Business Chick YouTube channel. Hospice agency, hospital, intermediate care facility for developmental disabled, nurse registry. There's some people that go this route, the nurse registry route. We'll talk about that in a little bit. Nursing home, organ procurement, prescribed pediatric extended care center. This is something just back down memory lane. This is actually something I thought about opening a while back and did a lot of research on it. Residential treatment centers, residential treatment facility, transitional living facilities. Okay, so today we are talking about none other than the home health agency. So I'm gonna let you see what the application looks like first, and then I'm going to turn my screen so that we can have a face to face. For those of you who are logging on, please don't forget to share this out because there could be someone else who is like, I want to know what's going on. How can I do this? Um, don't gatekeep. Don't be a gatekeeper. Let's share this out um, today as I am walking you through step by step. So let's look at the application together. I gotta close this out so I can open up the other application. Oh, that was from something else I just did earlier. Okay, it's fooling. Wait for the application to open. Do, 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 do. Okay, while we're waiting for that to open, I'm just gonna flip the camera real quick and uh do a check and see everybody. Thank you for sharing the live. Thank you for sharing the live. Good afternoon. Good afternoon on TikTok. And we're going to learn some things about Florida, the Home Health Agency license. So even if you want to talk about another state today, we are going to stay on, I'm going to put that up there, the Florida Home Health Agency. Starting, let me put this in the comments, a home health agency in Florida. All right. And this series is because we do have, okay, put that up. Hey, all right. So now that we have the screen shared, I got the application. Let me show you guys what that looks like. The browser has blocked the screen. Okay, a minute. Sorry, guys. I'm trying to share. Come on, let me share this. Why is it not showing me? Windows. Okay, here it is. Was not letting me trying to share this. Okay, here we go. Here we go. Here we go. Here we go. Thank you so much for the hearts. Okay. All right. So first, let's look at the application, and then we'll go backwards. So this is the application, and as you can see, it says, ooh, 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 ooh. I think because I'm doing the most, I'm like broadcasting from multiple places today. Let me see. No, that didn't make it better. Okay. Let me do that. Let's pull it back a little bit. Okay, so it's just the home care license application. The Agency for Healthcare Administration, which is ACA, they now have it where you can submit your application online. But this is what the application looks like. So you're going to put your provider information. Now, remember, this is the same application you would use if you are if you are renewing your license. So don't pay attention to putting the license number, the MPI number, the Medicaid number. Just start with your name of your agency, the address. You for this particular license, you cannot use a home address. Okay, I'm going to say it again. For this particular license, you cannot use a home address. Okay. The contact person's usually a owner or the administrator. Licensee information. Okay, most applications are going to want to know your business structure, This the licensee name. This is the owner of the home health agency. Your EIN number and address. This could, like, say for example, this could be your mailing address or your home address, or you can just click the same as above. Then application types. This is an initial application, so you would type yes. If yes, provide the name of the agency. If different, EIN number and the date prior to license or expired or close. Also, sorry, it says was this previously licensed? No, you were not. If you were doing it as a renewal license, you would click here, and renewals must be done no less than 60 days prior to the expiration to guarantee that it would be approved or and process in time. Then they have a category if you have a change of ownership, meaning you're selling your license, your agency, or transfer assignment of 50%, 51% of more of ownership, shares, membership, or controlling interest. Okay. Change of agency during period, whether you have the name change, you have a the name change, you have the address change, you have a change of services. You can do that in between your licensure period. They were going to charge you a fee for making that change. Non-fee required, you have personnel, you're adding a management company, you're changing your hours of operation, you get accredited, you transfer or assignment of less than 51% ownership by members or controlling interests of the license. Okay. Here we are. I want to go over the licensing fee. All right. So for the first time, your licensing fee, it's going to be $1,705 paid to the state. But if you are new, adding any additional services, or you have a change of ownership, you want to add on this $300 assessment fee. So essentially, your initial fee is $1,905. Okay. This goes over controlling interest, which talks about who is the owner. If you're LLC, it go over who is like the members, the percentage of ownership. And now something new to Florida's application is they want to know, are any of the owners non-immigrant alien? They want to know, guys. Pretty standard for them to ask about the board members or officers of the licensee. They want you to list them out. Some states have this management company. Essentially, it's a company that manages your operation. They don't own it, but they just manage your operation. Then they talk about the controlling interest of the management company. And we can skip over that for now. Personnel. For this license, you need to have an administrator. Now, they do have qualifications for the administrator, okay? The administrator can work for the home care agency, but they either want that person to have previous experience in a healthcare program or be a registered nurse for this particular license. Then you need to have here it is right here. 1 year of supervisory or administrative experience in home health care or facility license underneath Chapter 395, which is Chapter 400. Part 2, nursing home, Chapter 3, Part 1, assisted living. So either they had to have some kind of previous experience as a home care agency with as an administrator. Then the same for the alternate administrator. They want that person's contact information. The administrator has to be able to pass a background screening. Next, you have to have a director of nursing, whether you are providing the non-skilled side of the home health agency or skilled, you got to have a director of nursing. Now, you don't have to have an alternate director of nursing, but you do have to have a director of nursing. And then you need to show that RN had at least 1 year of supervisory experience, and he or she has to be able to complete a background check, right? And then you can pull the information of registered nurse. Then you need to have a financial officer who is responsible for the financial operations. And then you're going to put their information there. This person doesn't necessarily have to have a criminal background check. Required disclosures. Remember how I say, if you're ever caught operating a home care agency, they can prevent you from starting one. And if you were operating one, you weren't licensed, the required disclosures usually go over those questions, right? And they go back to even someone who hasn't worked for the agency who may have gotten charged with that fine. Then you have, this is more so if for an existing agency, if they had a fine that was associated with them having an agency and they're renewing their license. Accreditation is not required for you to be accredited if you are a non-medical home care agency. It is something you required for the medical part, and so they're just asking for proof of accreditation. You would need to put the days and hours of your operation, and guess what? They're giving you a limit. You gotta put it Monday through Friday, and it has to be at least between the hours of 7 a.m. to 6 p.m. And it has to be for 8 hours. So they won't let you do less than 8 hours. Geographic area. Now, one thing interesting about Florida is that you have to pick a geographic area. So let's say, for example, if you want to pick Miami, you don't get Seminole, right? It says that you can only pick one initially, and you have to pay for each additional region. You're going to complete the application. This has to do with renewals. And then you're going to tell them what kind of agency you are going to run. They do allow you you to hire contractors. So for nursing, that's why it says direct employees or contractors. If subcontracting from another agency, you got to write the agency name right here. And then you would put the number that you have. So it would be 1. If you're not doing physical therapy because you're not a home health, you would put 0, 0 for speech, 0 for occupational therapy, 0 for respiratory therapy, 0 for IV therapy, 0 for nutritional guidance, 0 for medical supplies, 0 for medical social services. And then this gets into your non-medical, where you can put home health aide, certified nursing assistant, companion. So with this license, it will allow you to hire CNAs and be able to provide the personal care service. A satellite office is related. It's a related office in the same geographic area as the main office, operating under the auspice of the main office license. So a satellite office is not in another region, and that's why they're not going to charge you extra for it. A drop site might be located in a county within the licensed geographic service area. This is merely a workstation for direct care staff. Neither billing nor potential prospective client contact is allowed at the drop site. So you can list your drop sites. Okay. And then we get into some supporting documents. And this is where I'm going to break down this application, which tends to drive most people bonkers because of what it includes. All right. So I'm sharing my screen. And thank you for just allowing me to at least read through that part, right? Make sure looking at the message, looking at the message. We're talking about the home health agency application for the state of um, Florida. Let me stop. Okay. All right. All right. Make sure I don't have any other questions. Hey. All right. So, like I said before, this has been a big request. And because of how detailed this application is, I haven't really been wanting to go over it. But today is the day, right? And so um, I want to walk you through the application process. First, as always, whenever I'm going over an application, I want to show you the application because I feel like that's where most of you have the most fear about getting started, right? Navigating through the application, looking at the length. Like I know, like for the state of Pennsylvania, it's like 21 pages. Some people look at the length and they're like, oh my God, it's so long, right? And then they get overwhelmed and they put it aside. So today, together, we're going to go through the application, but more importantly, I'm gonna help you to understand um, how to get started. Um, of course, like any other home health care agency, you should start with your business structure. Um, your business entity, you want to choose if you're going to be an LLC or corporation. Um, you register with the Florida Division of Corporations. You can do it. You can do this yourself, or you can hire a close some screens. You can hire a resident agent. And if you're not familiar with what to put on the paperwork and you want to make sure you have everything right, I suggest hiring a resident agent. All right. Um, then after that, you're going to make sure that you have your EIN number for your agency. It's important for the license. As you can see, you have to put that information on your license. Then your business address, right? So your business address, I said when we were looking at the application that your business address on the application has to be a physical address first. Most people say, oh, can I use a virtual address? The answer is going to be no. And on top of you not being able to use a virtual address, you cannot use a home address. You have to use a commercial address because one of the documents that you are going to submit with your application or during your survey is you're going to have to show that your business is commercially zoned. Okay? You have to show that your business is commercially zoned. And I'm going to start a little pathway for our licensing here because I'm going to save this video on YouTube and you guys can go back and check this out. Okay. So this is Florida. Okay. So when we're starting with our business structure. Okay. And that is typically, we'll say your LLC or INC. And then you're going to get your EIN. And we know that's through IRS.gov. Okay. All right. So then before you even start completing the application, let's go over some of the requirements. Okay. Because these requirements is what get a lot of people saying, I got this, I'm ready to go. And some people make a whole U-turn and say, I am not doing this. I'm not doing this license. Right? I'm gonna tell you up front, this is your Super Bowl of licenses. this this application don't play, right? This is where you bring your game and you bring your change, you bring your coins, okay? So um you will be applying as a home health agency. So the home health agency application, we showed that first. If you just started completing the application, let's put that up there. Here's a little checklist. Here's a little checklist I want you to do real quick. I want you to make sure that you have a registered nurse. I want you to make sure you have a registered nurse. That registered nurse must be able to pass a criminal background check. Okay. Then I want you to make sure you have an administrator. That administrator must also be able to pass a criminal background check, and he or she needs to have either be a registered nurse or be have at least 1 year of experience in working at a health facility, like at assisted living, at another home health agency, at a hospital. And unlike so far, unlike some other states, the RN and the administrator can't be the same person. Okay. The RN and administrator can't be the same person. Okay. Right. Then you had your application fee, which we told you was the 1705 plus 300. Okay, that's your application fee. Then you have to have your business address. Your business address needs to be commercially zoned. No virtual. No virtual address. You guys hearing me? You guys hearing me? No virtual address. Okay. All right. Now we get that. So we got, let me put, let's put background check, background check, check. Okay. Because we want to make sure that your RN has a background check, your administrator has a background check. All right. And let me see. Okay, so these are the basics, right? And let's say we have the owner's information. Okay, this is the simplest way to break down the application. This is the simplest way to break down the application, that you have those things. You have those things. This is a quick checklist. This is not a thorough checklist. It's a quick checklist. These are the most important parts of that. Now, this is only for the application, okay? So those are the things for your application. Any questions before we go any further? Remember, today we're talking about the home health agency license application for the state of Florida. If you want to know about another state, first, I advise you to go check out my Savvy Business Chick YouTube channel, because I have a lot of other states where I break down the application over there. Today, because it's been requested for the past couple of weeks, I think even towards the beginning of October. Sean, can you go over how to start a home health agency in Florida? We already talked about the homemaker companion. So today we're talking about the home health agency. And if you know someone that can benefit from this, share it out. Remember, and for those of you who don't know me, my name is Sean, aka the Savvy Business Chick. I am the original home care business mentor. I started my very own home health care agency back in 2006 with the help of a mentor who just so happened to be a registered nurse, who just so happened to own a very successful multi-million-dollar home care agency. And for some reason, her family didn't want to learn how to start a business, or as I say, get the fish. So I was at the right place at the right time, and she was able to give me this game before she passed away. So because of that mentorship, I believe so much in mentorship. And that's why I'm here, several times a week, just sharing free information. Why is she sharing this stuff for free? Where else y'all gonna get it? Like, for real, where else are y'all gonna get this information? And just to bring some balance to the marketplace, I think the more you know, then I can help you better when you join one of my programs. But today, it's just about helping you to understand the application. All right. All right. So once you get here and you start looking at the application and you have like this like checklist, I want you to get some kind of strategic goal in mind. Okay. You want to start the application early. You want to allow time for your background screenings to come back, um, because in between that time, we need to be working with a requirement I didn't list yet. And so I'm going to pull it over here, and I'm going to talk about um, a very important financial requirement. A very important financial requirement. Okay. And this is something, sorry, friends, we can't do this on our own. We can't do this on our own. Um, Maybe you can get started, but don't try. Don't try. Okay. All right. So your financial requirement is, number one, you're going to have to submit a proof of solvency. Okay. Proof of solvency. And then you're going to have to do your financial worksheet. That spell. And here's the kicker: it has to be signed off by a CPA. So when we get to actual submission, the application goes to one place, the financial requirements go to another place. Okay, so let me try to show you what that looks like. We're gonna go right back to the ACA page, and I'm gonna show you. Here's my share button. Okay. Let me see. Let me try to pull it up first before it's on an Excel document. So I want to show you what it looks like. And I'm not showing you to scare you. I'm showing you to prepare you. Can we say that in the comments? I'm not showing you to scare you. I'm showing you to prepare you. Who likes to be prepared? Who likes to be prepared? Okay, share the screen. Share the screen. You right? All right, this is their document, not mine's. This is their document and not mine's. Okay. Okay. All right. So here's what it looks like. Right. Here's the beginning of it. Right. And then this is for, you see this? This is for adult daycares, assisted living, all of those places that we mentioned on that site, and to include home health agencies. This is the instructions. This is the instructions, right? So Schedule 1, you are, as a provider, supposed to do an estimated cost and source of funds, right? This is to show the cost to begin to operate, including pre-operation costs prior to the beginning of operation, funding for contingencies, and the funds necessary to sustain operations. All funding must be supported by evidence. Okay, so let me show you. And then we're going to go over staffing, Schedule 2, which is the staffing requirements, Schedule 3, hours and charges. Okay, so let's just see what these look like. Okay, so essentially Schedule 1 is almost like your startup budget. It's almost like your startup budget, right? This is what it looks like, right? And then they have a checklist of that they're going to check your proof of funding. So I need to tell you that if you say you got $35,000, they're going to want to see that deposit in the bank, right? Here is your workup of your staffing requirements, right? Where you put in the amount of FTEs you have. FTE stands for full-time equivalent. Okay. If you didn't know that term, put it in the comments because we're learning today. Okay. And remember, note takers are money makers. We're learning today. Full-time equivalent. This is a term you want to be familiar with. It comes up from time to time if you're going to be doing healthcare government contracts, if you're going to be getting different kinds of sourcing, right? So then you would need to put down the salary for the administrator. And I know you're like, but I'm not taking a salary. Guess what? That's not going to fly on this document. The salary for the director of nursing. And it has to be an applicable salary or cost involved for what you're going to pay him or her, because this has to cover year 1 and year 2. Okay. And then you're filling out their form for the healthcare professionals. These are direct employees only. And then your grand total. Schedule 2 looks like this. if you have contracted services, if you're using a RN as a contractor, then you can put the hourly cost there. Again, it still has to be comparable for what the going rate is in the state. Schedule 3 is your hours and visit charges, essentially how much you're going to be billing for the service. And this is why you can't guess. You got to have your accurate amounts. And then you break those down into the services you're offering, and then the value of that for the first year and the second year. You don't have to fill out Schedule 3 because that's to do with the home medical equipment. Your projected operation revenue year 1, and they will have you break it down by category. Okay, this is for an agency that's going to be Medicare approved. That's why it says episodes, number of patients, other payers. See, even they know those other payers. Your balance sheet. And then your summary of revenue and expenses. Okay, that was a lot. Let's take a breath while I change the frame. All right. Okay, I forgot to flip it over for Instagram. Sorry, guys. Okay. Let me look at some of the good question. Before I move forward, all of the forms are on the AHCA website. All of those forms are on the AHCA website. I'm not holding them hostage. The application, the checklist, they're all on the AHCA website. And that's how you know they're the correct form, because sometimes people will give you dated forms. All of these forms are on the AHCA website. Now, underneath the Home Health Agency, you have the AHCA. Let me look at this. You have, why is it here? Can you see it? Oh, sorry, let me go up. You have the application. You have the checklist. You have the application addendum. This is what I just showed you, the proof of financial ability to operate. The excellence in home care application, that is for if you are an existing agency and you are renewing your application. So you don't need that initially, okay? You don't need that initially. Yes, okay, so going back to your question, so we can make sure you have an understanding. So let's say, for example, you are an accountant or you are a bookkeeper, right? You can complete those spreadsheets. As you see, it says Schedule C, blah, blah, blah. But in order for it to be approved, it has to be signed off by a CPA according to AHCA's rules. So they will accept it if you do it. Let's say I'm a junior accountant, or I'm an accountant. I have the skills to pay the bills. Fine, fill it out. But you can't sign off on it. Their rules say we want that. And we want proof and we want evidence of these things that you're talking about. Now, one thing that I find that's good on the non-medical side, what I like is that when they go show proof of financial solvency, because this state checks. So this is the application that does a bank check. Okay, so I want you to be prepared for that. This is This is the state that does the application check. They're going to check your bank account. So at the end of that financial workup, if you say, yeah, so we have allocated $47,000 in for our startup, right? And they look and it matches your budget, your expenses, blah, blah, blah. They are going to want to see a $47,000 deposit. Now, thankfully, on the non-medical home health agency side, they're only going to check it one time. And after they check it, you can move that money back to wherever else you need it. If you need it to put it back in your home equity, if you needed to give it back to, whoever was an angel investor, you can. On the Medicare side, child, please, you in there till they approve you. That is a look, love, but don't touch fund. You might as well just forget about it. Right? Because they're going to check it multiple times. With the non-medical home health agency, they only check it one time. And then sigh of relief is over. Yes, full-time equivalent. Okay, so Maya said, how much proof of funding is required? So here's where you guys always ask me, well, how much money do I need to start this home care business? Here is where that price gets real. Okay, I can't tell you 25,000. I can't tell you 35,000. The lowest for this is the state. This is the license type. Remember how I always say it's not necessarily about how much money, it's the license type, right? This license type is letting you become a home health agency, which is the top tier, right? But you don't have to be Medicare certified. So if you're going the non-medical route, the rule of thumb is 50K. 50K for your proof of funding. It's not even what is required. It is usually what they will accept. Okay? It's usually what they will accept. It has nothing to do with the requirements. They technically can't tell you we require you to have 75,000. It's what they would accept when you finish doing your workup. Now, on the medical side, you're looking at anywhere from 100 to 150K, right? On the medical side. Why? Because now Medicare is involved. Medicare is involved, and they're like, ain't no way you got registered nurses, PT, OT, and you doing all this for 50K. No, we're not buying it. So that's why I push for starting initially as a non-medical home care agency, right? But some people want to be Medicare certified. That's fine. That's fine. Are we talking funding? No, we're not necessarily talking funding. I think I missed some of your questions. Have I got caught up so I can continue on? Have I got caught up so I can continue on? No, yes, non-medical. And Demi Brands, the least amount that we were able to show in an account one time was 43K. So I just say safely 50K. And one thing that they challenged was like literally we had to bring the administrators salary down. We had to say, well, you know what, the administrators only making $16 an hour, and they could not dispute that. But they would literally look at how much an RN is making, and you have to put that supporting document evidence on your information. Okay, thank you so much. Okay, so let's go back. Okay, you guys see why it's taking me so long to do this. Okay, so we got okay, all right, so we said you want, even though we went over looking at the application, there's a couple of things you need to do first before submitting the application. One is start working on its financials, right? Because start working on your financials and which includes your startup budget, and it's going to include an operational budget. Startup budget is all of your startup costs, your startup capital. Operating, it has to do with your sales, your expenses, how you're going to continue on your operations. And they know, guess what? They know that you paying for an office space. So they want to see, okay, so you say you're paying $700 for an office space. They want to see everything. They want to see all of these details. Okay. Um, so you want to handle your background checks, make sure that those come back and are approved. Then you want to also address your financial requirements. Okay, you do not have to do accreditation at this stage. You do not have to do accreditation. If you are, when you are initially submitting your application, just focus on the application, whether it's medical or non-medical. It's only until if you are doing medical, you will need to do accreditation. Okay. Again, if you're doing medical, because Florida's medical home health agency license type, it's not like Texas. Like Texas will say, hey, if you want to be a home health agency, we give you the option of being Medicare certified home health agency, or you're just going to do private insurance and Medicaid. And so they give you like two different routes so that they can know how they're going to survey you. If you're applying to be a skilled or medical home health agency in Florida, you're going to automatically have to go through accreditation. Automatically. But that's after you submit your application. Let me take a sip of water. Okay. So we just went over the proof of financial ability to operate form. That is ACA form 3100-0009, which is required. Okay. And something else, even you can only start with one region. You can only start with one region. So you have to make sure that you're starting in the area that you can be the most successful. Let's not talk about oversaturation and competitiveness, because Florida, Texas, and California have the most home care agencies. You can look that up. Where do the states have the most home care agencies? Those three states are at the top. However, people start agencies all the time. Larger agencies are not afraid of competition, you guys. Larger agencies are not afraid of oversaturation. No, I'm not a nurse. Larger agencies see that in a different way than we do. You know how they look at it? They say, oh, if it's a lot of agencies there, that means it's a lot of need there. See how they look at it differently than we do? They say a lot of agencies must be a lot of need. Right? We're talking about Florida. We're talking about Florida. Okay. All right. So we went over that. Okay. So circling back to the requirements. Okay. Your administrator, your director of nursing. I have to make a correction. Your director of nursing is for if you're offering the skilled services. If you are going to be a home health agency, non-skilled, non-medical, that was that space for the RN. The RN still needs to complete a criminal background check, right? So you want to start thinking about your positions: the administrator, director of nursing, the registered nurse, who would be your clinical staff if you're doing medical, your aides and companions, Um, all of those people on your application must be able to pass a level 2 fingerprinting based background check. For positions like owners, controlling interests, administrator, director of nursing, RN. All right, so we start up fine for your financials. We've talked about your startup costs. That's going to include your licensing fees, accreditation if you go that route, insurance. Okay, there are the insurance requirements are on the application. We go back to the application. General liability, there's 3 insurances: general liability, professional liability, the way they call malpractice, and then you have your surety bond insurance. I'll go over the requirements in a second. Those are 3 insurances that you have to have. And people say, do I have to have the policy initiated prior to getting a license? The answer would be yes. Okay. Okay, so you have your startup costs. And if you have it, it should include software and marketing in your startup costs. Your ongoing costs or your operating costs are things like travel to and from, home care visits, your electronic medical records, any your bank fees. If you're using like a billing company, compliance costs, training costs, costs for the criminal background checks. So you have to include all of that. The revenue model, that's more so for the home health agencies who are going to be billing Medicare, Medicaid. It covers the different kinds of payers. And then you need to put a break-even analysis on your financial documents, giving your market in your part of the region and the state of Florida. You would need to include what volume of patients and payer mix you will need to cover costs and to have an actual profit. That's why I said don't do that document on your own. Get some assistance. Right? Great. So let me go over to the next part. Okay. So we got complete a home care application, financial requirement. All right. Let's say you submit. Okay. So because of the time frame of this part can take, let's say, 60 days. This part can take 60 to 90 days. Right? So essentially, you would think, wow, it's going to take me less than 90 days to get approved. Here's the thing, right? Once you submit, it goes to 2 different people, right? All right. So it goes to 2 different people. Essentially, once you submit and they want you to do the online submission, it's going to go to the regional manager, right? And then the I don't know why I put that right there. So you go to the regional manager. They the financial part, they can take up to 60 days to review your finances. If everything is good, then and they don't send it back, you're done with that part. Um, Essentially, the regional manager is only reviewing the application, right? What do I mean by that? They're only reviewing the application, making sure, okay, the RN is good, the administrator is good, they meet all of the requirements, we got the application fee, all right. But they're checking the application, right? So they like check, check, right? The last step is the survey. And this is where they come to your office. Now, this one, what we found is the trick can take up to 6 months to 9 months, right? Why? Because this gets assigned an RN surveyor, right? So, got submitted, regional manager, gets sent to financial, they checked it, they review your application, that's good. Okay, your final check is the survey that's done at your office. The survey at your office is when they actually go through your policies and procedures. That is the last and final thing that they check is your policies and procedures, and they do it on site. Anytime you have an initial survey, they will check your policies and procedures on site, right? They will check your policies and procedures on site. So then let me go over what some of the policies and procedures they're going to be looking for. Okay. Admissions and intake policies, and that includes your patient and acceptance policies. Those policies should include your criteria for accepting patients, documentation, your informed consent, and your assessment process. Your plan of care and service coordinating policies, how you develop the plan of care, how you review it, how often is it updated, how do you coordinate care between skilled agency or skilled needs versus the unskilled needs. For Florida, you must follow the rule of 59A-8.0095, which says the director of nursing or administrator shall adopt policies and procedures considered consistent with CDC/OSHA for safety, universal precautions, infection control. Then you have to have a policy for staffing and training and competency. They're going to want to see that staffing, your staff hiring process, the qualifications of the administrator, the qualifications of the director of nursing, if applicable, training for home health aides, your competency tests, your background screenings for a level 2 background check for certain staff. Then you would have your policies for infection control, universal precautions, and biomedical waste. Those policies are to include infection prevention, handling and disposing of biomedical waste as required by the state of Florida, medication administration and or delegation, how medications are handled, meaning your storage of medication, how the RN would do delegated tasks, what is the oversight for aides versus nurses, documentation, which is covered in Rule 59A-8. Then you would need to have policies on. Got to verify because I guess it's an hour. Quality assurance and performance improvement. You need to have a QAPI or a QAPI program. Again, QAPI stands for Quality Assurance Performance Improvement. I actually am going to come up with a workbook for this because we're finishing this up in the Home Care Kickstarter program. And I said, not enough people talk about quality assurance, and people know that they need to have one, but I think people just don't know what to check. So actually, I started working on like a 6-page workbook of what you should be checking on a monthly basis, on a quarterly basis, and on an annual basis, right? So with this, you need an ongoing quality program review. And then, so that would really go along with that. Review of active and closed records. Those are your client records. Review of outcomes and any corrective actions, right? That's the policy. Then this is a big one. This is a big one. The emergency management and continuing your CEMP plan for emergencies. And that's like that includes natural disasters, hurricanes in Florida, staffing shortages, and service interruptions. That one is usually submitted as a separate emergency preparedness plan. Other states would do it if they have a lot of natural disasters in their area. Billing compliance and fraud prevention, how to bill payers. You would have to have that policy for Medicare, Medicaid.
And I have one.
Yeah. Okay.
What?
On the other side of the car.
Okay.
Okay. You want me to get it or you got it? Sorry. Needed to help my assistant. Let me know if you don't see it. She doesn't know where it is in the garage. Okay. Service termination and discharge. Policies for ending services, transferring care, closure of episodes, and client rights. Then human resource policies on how you would, versus your employee versus contractor management, hiring, the contracts, orientation, performance reviews, termination, and background checks. Then we have patient rights and grievances, complaint handling, ensuring clients know their rights, how to raise complaints, how do you respond to them, and appeals. Hey. Okay, so I just want to go through the details of that. Remember, I said this is a hefty license, and hopefully you guys don't mind that I'm not rushing through this because it's a lot. It's a lot, right? But guess what? If you decide to do this, we have a kit for this. So don't worry about a team. Every little team. Okay, so now I want to talk to you about a little bit of the population and what are some good areas for you if you want to pursue this license type. I've said before, the easiest license to get in the state of Florida is the Homemaker Companion, but it does come with some restrictions. In the state of Florida, the Homemaker Companion, you're not supposed to touch the client unless you have that wonderful exemption. You can only get that exemption if you are a healthcare professional, right? And it only covers that person, right? But guess what? There's plenty of agencies generating high 6 figures. I'm talking about 8 9s, and even some in the $1.9, $2 million range who are doing this app or who are doing a Homemaker Companion. So if you want it easy and you don't want the stress and you don't want that financial proof of ability to operate, go that route and start small and then grow your way to this one. But if you're ready to take on a hefty agency license and just position yourself for what's to come, because we have to remember the senior tsunami is coming, right? And we get our first wave. Anybody remember when we get our first wave? let me know. I want to see the answers to the pop quiz in the comments. When do we get our first wave? Oh, congratulations. I'm so glad. GT, I be getting on my daggone nerves. Congratulations. 1 and 30. Thank you so much. All right, thank you. Okay. Okay, so let me tell you about a couple of areas. Sarasota. Sarasota. Okay. Um, the medium household in Sarasota is about 70,000 a year. Um, let's see. The average household listed 127. Oh, they're talking about, um, how much people are making according to the system, the census. Let me read through this that my mentee gave. I'm sorry, that my assistant gave me. Mhm. Sarasota has a good amount of older adults and retirees. This is a strong market for home health and home care agencies, especially those focusing on aging and chronic disease and post-acute care. The income levels are decent in this part of Florida. Um, and so that suggests a willingness to pay, whether that be out of pocket, which we always look for initially. Affluent areas to target within Sarasota and the surrounding counties. They have luxury neighborhoods, beachfront areas, retirement communities, and you can do a marketing strategy to really um, get to those affluent areas. Then we have Tampa. It Tampa is a one of the fastest growing populations in the state of Florida. It's presenting a new pocket of um, affluent individuals who that's would be a good position for private pay. For home health agencies, you could target affluent suburbs who have disposable income, plus target some of the baby boomers. Okay, then we have West Palm. We have Palm Beach County is among Florida's most affluent counties with many luxury homes, retirees, second homes, and high net worth individuals. The county appears to be near the top in the population with 1.5 million. Uh, their population is 1.5 million. The key takeaway about this area: high net worth, retire. These people retire rich. Strong demand for high quality home health care. Ideal agencies can position themselves for premium care, the concierge services for home health, specialty services, and you want to target affluent neighborhoods. All right. So I just had them look up 3 areas because I already knew that the other part of this would be really, really long. I'm going to tell you some rates. But other than that, do we have any questions? I'm making sure I covered everything. So we started off, for those of you who are just joining, we started off by looking at the Florida Home Health Agency application. The application can be found online, as well as the supporting documents like your financial proof of ability to operate that form. Those can be found online. Your basic requirements, you need to ensure that you will have a registered nurse to go on your application, that you yourself or have a registered meet the qualifications of an administrator. We also talked about how you will need a commercially zoned office space. The initial application fee is about $1,900. They will request the owner's information. You would need to submit a financial proof of financial worksheet that is signed off by a CPA. That is a part of their financial requirements, and show proof of solvency. If you're doing the Medicare route for the home health agency, then Medicare will be checking for the proof of solvency, and they tend to check it more than one time. Because we addressed this, I want to put down in our notes. We said 50K was a good range for non-medical. And we said about 100, let's say 120K for medical. All right, it's the same application if you're doing medical or non-medical. You submit online now, and once you submit online, it goes through the process of going to a regional manager who reviews the application and makes sure that the financial requirements are sent to the to that department. They're looking for I did put insurance, right? Insurance. They're looking for a completion of the application, and that everything is submitted. And then your last step is that you get a survey from a registered nurse who comes to that office and reviews your policies and procedures. I can. Okay, give me a second. Okay. Lastly, going over this. Common pitfalls for this application. Failing to submit a completing application, of course, and missing documents, right? That's going to get your application sent back. Not understanding the staffing and training requirements, especially when providing skilled services. Underestimating startup costs and the cash flow requirements for that financial proof of solvency. Relying on one payer instead of diversifying. Not building strong referral networks early after you get started. For those of you who are in Florida, interested in this license type, what part of Florida are you in? I forgot to ask that. If you're in Florida and this is something you have wanted to know, give me the number 1. And I think I've covered everything. Went over licensure. I'm going to leave this up on my Savvy Business Chick YouTube channel just because, yes, I do. Just because this is such a hefty program. And I don't know about you guys, but have you seen anybody talk about Florida, this application in depth? Have you seen anybody talk about it? I haven't. I'm trying to find it. Remember, I'm trying to find the things that the gatekeepers are doing for Florida. Yes, we have one for Texas. Yes. Okay, cool. Definitely keep me posted. Does Medicaid or Medicare reimburse for damages? No. Why would they do that? Why would they do that? Going through the questions. I have a video on Tennessee. I am Jada. Thanks for sharing that we spoke on the phone a few weeks ago from Connecticut, and you finally got your golden ticket from GTI. GTI guys has been so exactly. K Business on YouTube said that's why you have insurance. I have to highlight that comment because that's pretty clear. When do you purchase insurance? You have to submit your insurance information with your application. Thank you for asking. We're talking about Florida today. All right. Anything else? I'm making sure. We talked about the non-medical route. Okay. I think I've answered all of the questions over here. Maureen on Instagram says, how concierge package structure done? How is the concierge package done? That is a long answer. But in short, who's heard of concierge services? Yes, I will explain the difference between DIY and mentorship. Who's heard of concierge services? Who's heard of it? I want to make sure you guys got a copy of this because it's going away. Bye bye. Bye bye. Bye bye. Who's heard of concierge services? It's going away. And then the last, I'm going to break down DIY. Okay. All right, all right, all right. I got asked a question. What's the difference between my DIY kit and my mentorship program? And I'm trying to make this a little bit more clean, but this is what we have right now. So make it a little bit more clean. All right, the DIY kit, done, do it yourself. Mentor guided. Okay, probably should do two different colors. Okay, state specific policies and procedures. State specifics, policies and procedures. Okay. Application assistance. Limited. Application assistant. Forms. Limited. Forms. And then we go into 40 hours of live training. We got one-on-one mentorship, Zooms. We got app, peer group, peer mentorship. And then we have our let's just say 6-month mentorship. Okay, so try to write it out. I know you guys can't see it. The DIY kit is a do-it-yourself process. You receive the state-specific policies and procedures for your state: Texas, Kentucky, Kansas, Oregon, California, Indiana, Florida, North Carolina, South Carolina, Maryland, Virginia, whatever it is. You get those policies. It's state-specific. You get some assistance with the application. You see how I went over the application in this in that video in this training? That's our application assistance. In a sense, we have an explainer video making sure that you submit your application. It's limited assistance because you're watching a video. Forms, you get a limited amount of forms. Whatever forms that are supposed to go with your application, we're going to give that to you. So say, for example, for Maryland, you need a business plan to go with that application. So that kit includes a business plan, right? For Georgia, they want to see a service agreement, a client contract. So that one includes a client contract. For Florida, they want to see emergency preparedness plan. So that one includes emergency preparedness. And that's why they're state specific, because whatever the state requires, you're not getting a whole bunch of templates, right? You're getting the specific documents, specific policies you need for your state that's according to the state regulations that comply with what they're asking you for. So if they ask you for a staff training policy, it's going to be whatever the staff training policy requires. So that's why it says forms are limited. On the Home Care Kickstarter program, and the next one starts January 12th, 2026, right? We have enrollment open now. You have mentor guided. This is now you have a mentor that's helping you with your application. You get your state specific policies and procedures. You get your application assistance because you'll either be getting it in our live sessions or you can use one of your Zooms to submit your application. Then you have forms. In addition to the forms that you need for your license, you're going to have forms for things like your HR forms, your client forms. I forgot to mention, you also get handbooks. Your employee handbook, your client handbook. You get 40 hours of live training. Okay, so when I tally up how much time we spend in our 9 to 10 week live Kickstarter program, the sessions are about 2 hours each. So you essentially you get 40 hours of training within that program. We're covering compliance. We're covering how to handle complaints. We're covering how to get your first client. We have about 8 trainings on marketing. We're covering HR. We're covering billing. We're covering different topics that you have. You're able to be in a live class, because I know a lot of people have these pre-recorded classes. They'll be pre-recorded after your session has finished, and then you have a lifetime access to those trainings. Okay. Then you have your one-on-one mentorship. For the Home Care Kickstarter, you get 2 one-on-one Zoom sessions, right? You can use at any time. We have our WhatsApp group that is specific for those peers. So like we have our Kickstarter doesn't go up over 25 people. So you got 25 people that you know and trust that are walking with you at the same time of you getting, and so they end up being your Kickstarter peers. You know, you build a relationship with them. We're celebrating wins when someone says they got their license. We're celebrating wins when someone says they got Medicaid approved. Whatever is going on, we're celebrating them. Then it's a total of 6 months, right? So even though our live sessions are about 9 to 10 weeks, like we started our current one on September the 8th. Our last session is this coming Monday. So that was about 11 sessions, right? Every Monday at 8 p.m. Eastern Standard Time, giving time for people who are on the West Coast to be able to join the program, right? So with that, you're getting a lot, and you're able to show up. You can anticipate, you can change your schedule. We have people who are nurses, people who have different work schedules, who are able to join the live and participate, because it's nothing like asking question and having me answer your question in real time. Okay, so as far as we have the Home Care Kickstarter only 3 times a year. Why? Because it's me doing it live. If it was pre-recorded sessions, then we can have it all year round. But because I need a little mini break, we actually don't only do it 3 times a year anyway. We do it winter, spring, and fall. Do it winter, spring, and fall. And so we've had 3 people enroll already for the next home care and or home health care Kickstarter. And so for those who want to go on a payment plan, we have options like Klarna or Afterpay if they want to go on a payment plan. For those who don't want to have their credit run, we have an internal payment plan where you pay directly to us, and we give you initial access to the portal, but you don't get your policies and procedures until after you've made your final payment. Those who have paid in full, we actually are submitting applications for them before Thanksgiving. Why? They paid in full. They want to have the satisfaction that their application is almost being approved prior to starting the next home care Kickstarter. So that answers your question. When are you offering your mentorship? We do it 3 times a year. And it's not just licensing. It's definitely helping you to get started, understand how to operate your business. Any other questions? Yes, I will do another video. I have a question on YouTube. I follow you on all platforms. I've learned a lot. But can you please do a video starting an agency in Texas? I did want to start an agency in Texas. I will do one by next week because with everything happening, we want to get anyone who wants to take advantage of either joining the home care Kickstarter, which is our next cohort, or getting the one of the DIY kits. I want to make sure you have a good understanding of the state that you are starting. Yes, ma'am. The next one doesn't start into January, but if you're making a full payment, then we are able to use licensing, so your Zooms to help you submit your application before January, and you get early access to the portal to start watching some of the training videos, which every program we have someone that joins early, every program. So meaning they enroll early, they get started. We had that happen for Texas and Georgia this past one. And so midway, they were kind of already licensed. To get early access, send me an email to mentor@savvybusinesschick.com. And we have a flat fee. It's no hidden costs. People want to know what else I got to pay after this. It is straightforward. So the cohort will be teaching Texas. Yeah. Yep, we teach on taxes. Yes, we do. And send me it's on my website. Actually, I think if you go click the link in my bio, and we have one price for skilled versus unskilled. It's also on my website, savvybusinesschick.com. So I had a whole break, guys, after teaching on Florida. Wasn't it a lot? Wasn't it a lot? It was a lot. That was a big thing. But I hope it helped you in just know that, we're trying to make sure that you have the right information out here before you start. Whether you work with me or not, I would love for you to work with me. I would love to say that you're one of my mentees that not only get started, but because I'm more concerned about you getting your first client and your first 100,000 and your first million than I am about you getting started. Getting started is easy, guys. Take the first step. Take that leap of faith. Take that leap of faith. Whatever you have been worrying about, pray about it. Stop worrying about it, right? I'm telling you, it's people out here that look at situations different. Why would one person say the market is oversaturated and another person say, oh, there's a lot of opportunities there? I was just reading an article earlier today about and what would we consider a saturated market, Arizona, that a franchise is standing out, right? They said, oh, we normally offer non-medical, but now we're going to offer some more concierge services. And guess what? The concierge services they are going to focus on They're going to focus on offering non-medical concierge services for people who have cancer. I keep telling you guys, I I say it prophetically, the things that you need to start adding to your service menu, and some of you take it and run with it, and some of you got to hear it 3 other times. You got to hear that somebody that made $5 million off of that one thing before you say, "Oh, okay, now I'm gonna get on it." I tell you that that's not how these things work, right? You don't get onto Bitcoin when it's already 100,000. You don't get onto these things when it's already somebody's already work. You get on it early. That's not how these things work. Thank you so much, Lady Russia. That's not how these things work. So, you know, how it works is you get on it early. You get on it early and you exhaust it. You exhaust it out because someone that's working with a bigger agency, someone that's at a bigger agency now all of a sudden wants more personal, they want more hands-on care. They would love to transfer to your agency. Okay, cool. Then you should do that. There's plenty of marketing opportunities for there's plenty of marketing opportunities available this time of the year. So if you want to do that, go do that. All right, guys. Thanks so much. Have a good one. How do you find clients? You have to market, but that's not, you know, I keep I keep I keep saying the same thing. You have to market. You have to market. It's not a complex question. You have to get yourself out there. And if you're afraid to get yourself out there, then that's what you have to address. Yep, I do a la carte training. Um, because because I didn't do the home care boss up challenge, my schedule was just way too complicated. Um, I actually added some more things to the home care home care. Uh, it's called the holiday marketing bundle. It's like um three videos and some social media things. Let me see if I can find it. Check my link in my bio by 7 o'clock today. It'll be there. Because more so we're gonna do a planning. I was trying to do something for Black Friday where I help you guys plan your whole 2026. My mentorship program is on my website. I don't know if you're doing skilled or unskilled. Okay. RN in North Carolina, wanted to start a non-medical. You're so helpful. Thank you. And if you haven't already seen my how to start a home care agency in North Carolina, go check that one out. I'm signing off, guys. Have a good one. Bye. Bye, guys. Bye, guys.